Question 1. Quality control measures reveal that a behavior analyst has defined the target behavior for a client with autism as demonstrates frustration. This definition is being used to track instances of the behavior. Which of the following is the most appropriate definition for a target behavior in this context, adhering to professional and ethical standards? Option A. The behavior is defined as exhibiting signs of distress or unhappiness. Option B. The behavior is defined as emitting at least 3 distinct vocalizations above a conversational volume within a 30-second interval, accompanied by a clenched fist or rigid posture. Option C. The behavior is defined as seeking attention from caregivers. Option D. The behavior is defined as engaging in non-compliant actions. Correct answer is B. The behavior is defined as emitting at least 3 distinct vocalizations above a conversational volume within a 30-second interval, accompanied by a clenched fist or rigid posture. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis, ensuring that target behaviors are defined in a way that is observable, measurable, and objective, as required by ethical and regulatory standards. The challenge lies in the potential for subjective interpretation, which can lead to inconsistent data collection, ineffective interventions, and ultimately, compromised client welfare. The BCBA must navigate the nuances of behavior definition to ensure fidelity and accountability. Correct approach analysis. The correct approach involves defining the target behavior using clear, objective, and measurable criteria. This aligns directly with the ethical principles outlined in the Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts. Specifically, the code emphasizes the importance of using scientifically evaluated methods and ensuring that services are based on research and professional literature. An objective definition allows for reliable measurement by multiple observers, which is crucial for evaluating intervention effectiveness and ensuring client progress. This approach upholds the principle of beneficence by ensuring interventions are data-driven and effective. Incorrect approach is analysis, an approach that defines the target behavior using subjective or internal states, e.g., is frustrated, is feeling anxious, is problematic because these are not directly observable or measurable. This violates the principle of objectivity in measurement and can lead to significant inter-observer agreement issues, making it impossible to reliably track progress or determine intervention effectiveness. Such definitions are not scientifically sound and can lead to misinterpretations of client behavior, potentially resulting in inappropriate interventions. Another incorrect approach is defining the target behavior in a way that is too broad or vague, e.g., is disruptive, is not complying. While these terms might seem descriptive, they lack the specificity required for accurate measurement. What constitutes disruptive or not complying can vary significantly between observers, leading to inconsistent data and an inability to determine if an intervention is actually changing the behavior. This lack of precision hinders the scientific integrity of the practice and can lead to ineffective or even harmful interventions. Defining the target behavior based on the presumed internal motivation or cause rather than the observable action, e.g., is seeking attention, is trying to manipulate, is also an ethical and professional failing. Behavior analysts are trained to focus on observable and measurable behavior. While understanding the function of behavior is critical, the initial definition of the target behavior must be based on what can be seen and counted. Inferring motivation before establishing a clear, observable target behavior can lead to premature or incorrect assumptions about the behavior's function and the appropriate intervention. Professional reasoning. When faced with defining a target behavior, a behavior analyst should first consider the core principles of ABA. Focus on observable and measurable behavior. The process should involve 1. Identifying the general area of concern. 2. Breaking down the concern into specific, observable actions. 3. Defining these actions using clear, objective language that minimizes subjective interpretation. And 4. Ensuring the definition is measurable in terms of frequency, duration, latency, or intensity. If there is ambiguity, consultation with colleagues or supervisors, and pilot testing the definition with multiple observers to assess inter-observer agreement are crucial steps to ensure reliability and validity. Question 2. System analysis indicates that a behavior analyst is reviewing data from a multiple baseline design across participants for a challenging behavior. The visual analysis of the data across the 3 participants shows some variability and inconsistent trends, making it difficult to definitively conclude a functional relation between the intervention and the reduction in challenging behavior for all participants. The analyst is considering how to best interpret these findings to inform treatment decisions. Which of the following approaches best reflects best practice in this situation? Option A. Focus exclusively on whether the challenging behavior has decreased by a predetermined percentage, ignoring the experimental design and the need to demonstrate a functional relation. Option B. Rely solely on the subjective impression of the data's overall trajectory, disregarding the variability to make a decision about the intervention's efficacy. Option C. Conclude that the intervention is not effective due to the lack of clear visual demonstration of a functional relation and recommend discontinuing the intervention for all participants. Option D. Conduct a statistical analysis appropriate for single-subject designs to supplement the visual analysis, considering effect sizes and trends, while also re-evaluating the visual analysis in light of these findings. The correct answer is D. Conduct a statistical analysis appropriate for single-subject designs to supplement the visual analysis, considering effect sizes and trends, while also re-evaluating the visual analysis in light of these findings. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis, interpreting data to make critical treatment decisions. The professional is faced with data that is not clearly demonstrating a functional relationship, necessitating a nuanced understanding of both visual and statistical analysis to avoid premature conclusions or ineffective interventions. The ethical imperative is to ensure that interventions are evidence-based and effective, which requires accurate data interpretation. The challenge lies in selecting the most appropriate method for the given data and experimental design to inform clinical judgment, aligning with the BCBA emphasis on data-driven decision-making. Correct approach analysis. The correct approach involves a thorough visual analysis of the data, considering trends, variability, and level across conditions, while also acknowledging the potential utility of statistical analysis to supplement this interpretation, particularly when visual analysis is ambiguous or when the experimental design warrants it. This aligns with the BCBA ethical code, specifically Standard 4.01, Experimental Evaluation of Interventions, which mandates the use of experimental designs that permit evaluation of the relationship between behavior and intervention. Visual analysis is the primary method for evaluating functional relations in single-subject research designs, as it allows for direct observation of behavior change in relation to intervention. However, the BCBA also recognizes the value of statistical analysis when appropriate, especially in more complex designs or when visual analysis is inconclusive, as it can provide an objective measure of treatment effects. This dual approach ensures a robust evaluation of intervention effectiveness, prioritizing client welfare by ensuring interventions are demonstrably effective. Incorrect approaches analysis. One incorrect approach is to solely rely on statistical significance without considering the visual analysis. This fails to adhere to the primary method of evaluating functional relations in single-subject designs and can lead to misinterpretations, as statistical significance does not always equate to clinical significance or a clear functional relation when viewed graphically. This could violate Standard 4.01 by not adequately evaluating the intervention's impact through appropriate visual inspection. Another incorrect approach is to dismiss the data entirely due to a lack of immediate, dramatic visual change, without exploring more sensitive statistical analyses or considering potential confounding variables. This could lead to premature termination of potentially effective interventions, violating the principle of providing effective services and potentially harming the client by withholding beneficial treatment. Furthermore, relying on anecdotal evidence or subjective impressions rather than systematic data analysis would be a clear violation of ethical standards regarding data collection and analysis. Standard 4.01. Professional reasoning. Professionals should approach data analysis by first conducting a thorough visual inspection of the data, examining level, trend, and variability across conditions. If the visual analysis clearly demonstrates a functional relation, this is often sufficient. However, if the visual analysis is ambiguous, or if the experimental design is complex, consider supplementing with appropriate statistical analyses that are valid for single-subject designs. Always consider the clinical significance of the observed changes, not just statistical significance. If data collection or analysis methods are questionable, consult with supervisors or peers. The ultimate goal is to make data-informed decisions that prioritize client progress and well-being, adhering to all ethical and regulatory guidelines. Question 3. Operational review demonstrates that a behavior analyst is developing an intervention plan for a client exhibiting frequent instances of noncompliance with instructions. The analyst is considering two primary approaches to increase compliance. One involving the removal of an undesirable task when the client complies, and another involving the delivery of a highly preferred item when the client complies. Which approach aligns best with the ethical and scientific principles of behavior analysis as outlined by the back? Option A. The approach involving the removal of an undesirable task when the client complies, provided it is the only method that has shown any initial success in preliminary trials. Option B. The approach involving the delivery of a highly preferred item when the client complies, but only if the client explicitly requests this type of reinforcement. Option C. The approach involving the removal of an undesirable task when the client complies, as this is often a more potent motivator for some individuals. Option D. The approach involving the delivery of a highly preferred item when the client complies. Correct answer is D. The approach involving the delivery of a highly preferred item when the client complies. Explanation. This scenario presents a professional challenge due to the need to ethically and effectively implement reinforcement strategies while adhering to the Behavior Analyst Certification Board, BACP, Professional and Ethical Compliance Code for Behavior Analysts, the code. The challenge lies in selecting the most appropriate reinforcement strategy that maximizes client benefit and minimizes potential harm, particularly when considering the nuances of positive versus negative reinforcement and their application in a clinical setting. Careful judgment is required to ensure that the chosen strategy aligns with the principles of applied behavior analysis and the ethical mandates of the profession. The correct approach represents best professional practice because it prioritizes the use of positive reinforcement, which is generally considered more ethical and effective for long-term behavior change. Positive reinforcement involves the delivery of a preferred stimulus following a behavior, increasing the likelihood of that behavior occurring in the future. This aligns with the code's emphasis on using the least restrictive effective procedures and promoting client dignity and well-being. Specifically, the code e.g. 1.0.1 reliance on scientific knowledge, 2.0.1 practicing within scope, 4.0.1 describing the effects of behavior change interventions, 4.0.2 describing behavior change interventions, mandates that behavior analysts use evidence-based practices and interventions that are in the best interest of the client. Positive reinforcement is a well-established and scientifically supported intervention. An incorrect approach involving the consistent use of negative reinforcement without careful consideration or justification would represent a regulatory and ethical failure. Negative reinforcement involves the removal of an aversive stimulus following a behavior, increasing the likelihood of that behavior. While it can be effective, its application requires extreme caution. The code e.g. 4.0.1.4.0.2 emphasizes the need to describe interventions accurately and to use the least restrictive effective procedures. Relying solely on negative reinforcement without exploring positive alternatives or without a clear rationale based on client needs and safety could violate the principle of using the least restrictive effective procedures and could potentially lead to the creation or exacerbation of aversive conditions for the client, which is contrary to the ethical obligation to avoid harm, e.g. 1.0.1.1.0.2. Furthermore, failing to consider the client's preferences and potential for escape or avoidance behaviors associated with negative reinforcement could be seen as a failure to prioritize client well-being and dignity. Another incorrect approach might involve implementing reinforcement without a clear, data-driven rationale or without ongoing assessment of its effectiveness and impact on the client's overall functioning. This would violate the code's requirements for data-based decision-making and continuous evaluation of interventions, e.g. 2.0.6 maintaining records, 3.0.1 task analyses and curriculum development, 4.0.1.4.0.5. Professional reasoning in such situations involves a systematic process. First, a thorough functional assessment should be conducted to understand the antecedents and consequences maintaining the target behavior. Second, potential reinforcement strategies should be identified, prioritizing positive reinforcement due to its ethical and practical advantages. Third, the least restrictive effective intervention should be selected, considering the client's age, developmental level, preferences, and the specific behavior targeted. Fourth, the chosen intervention should be clearly defined, implemented consistently, and continuously monitored with objective data. Finally, the intervention plan should be reviewed and adjusted as needed based on the data and in consultation with relevant stakeholders, always ensuring adherence to the BAC code. Question 4. The control framework reveals a situation where a long-term client, who has consistently expressed a desire for increased independence in community settings, suddenly requests to cease all community-based interventions and remain solely within their home environment, citing vague reasons of feeling overwhelmed. The client's family, however, strongly advocates for continuing the community interventions, stating they believe it is crucial for the client's long-term progress and are concerned about the client's withdrawal. The behavior analyst must determine the most ethically sound and professionally responsible course of action. Option A. Conduct a comprehensive assessment of the client's current capacity to consent, explore the underlying reasons for the client's sudden change in preference, and consult with the client's support network and supervisors to develop a plan that respects the client's autonomy while ensuring their well-being. Option B. Inform the client that their request cannot be accommodated due to the family's strong opposition and the perceived importance of community integration for their progress. Option C. Proceed with the community interventions as planned, prioritizing the family's concerns and their assessment of what is best for the client's long-term progress. Option D. Immediately honor the client's request to cease community interventions, as the client has the right to direct their own services. The correct answer is A. Conduct a comprehensive assessment of the client's current capacity to consent, explore the underlying reasons for the client's sudden change in preference, and consult with the client's support network and supervisors to develop a plan that respects the client's autonomy while ensuring their well-being. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated desires and the behavior analyst's ethical obligation to ensure the client's well-being and the integrity of the profession. The behavior analyst must navigate the potential for coercion or undue influence, ensuring that the client's decision is truly informed and voluntary, rather than a product of external pressure or a misunderstanding of the implications. The core ethical tension lies in balancing client autonomy with the professional duty to protect vulnerable individuals and uphold professional standards. The correct approach represents best professional practice because it prioritizes a thorough, multifaceted assessment of the client's capacity and the environmental factors influencing their decision. This aligns with the BAC Professional and Ethical Compliance Code for Behavior Analysts, specifically the principles related to client welfare, informed consent, and avoiding conflicts of interest. By engaging in a systematic process of information gathering, consultation, and documentation, the behavior analyst ensures that any decision made is truly in the client's best interest and that the client has the capacity to understand and consent to the proposed course of action. This proactive and diligent approach safeguards the client and upholds the integrity of behavior analytic services. An incorrect approach that involves immediately agreeing to the client's request without further investigation fails to uphold the ethical obligation to assess the client's capacity and ensure informed consent. This could lead to a situation where the client agrees to something they do not fully understand or that is not in their best interest, violating principles of client welfare. Another incorrect approach, such as dismissing the client's request outright without understanding the underlying reasons or exploring alternatives, demonstrates a lack of respect for client autonomy and may lead to a breakdown in the therapeutic relationship. It also fails to explore potential underlying issues that might be contributing to the client's request. A third incorrect approach, which involves proceeding with the request while solely relying on the family's input without independently verifying the client's understanding and consent, creates a significant ethical vulnerability. This bypasses the client's direct agency and potentially allows for undue influence or misrepresentation of the client's wishes, contravening the ethical mandate for direct and informed consent from the individual receiving services. Professional decision-making in such situations requires a systematic process. First, identify the ethical principles at play, e.g., client welfare, informed consent, autonomy, avoiding conflicts of interest. Second, gather all relevant information, including direct observations of the client, communication with all involved parties, and review of existing records. Third, assess the client's capacity to understand the request and its implications. Fourth, consult with supervisors or peers when faced with complex ethical dilemmas. Fifth, document all steps taken, decisions made, and the rationale behind them. Finally, prioritize the client's well-being and autonomy throughout the process. Question 5. The risk matrix shows that a client's self-injurious behavior has a high probability of causing severe physical harm and has not responded to multiple reinforcement-based interventions. The BCBA is considering a punishment strategy. Which of the following represents the most ethically and legally sound approach according to the BAC regulatory framework? Option A. Implement a positive punishment procedure, such as response blocking, immediately to prevent further harm, while simultaneously collecting data on the frequency and intensity of the self-injurious behavior. Option B. Utilize a negative punishment procedure, such as planned ignoring as the primary intervention, given its less intrusive nature compared to positive punishment. Option C. Develop a comprehensive behavior intervention plan that includes a punishment procedure only after a thorough functional assessment confirms its necessity, includes a plan to teach and reinforce alternative behaviors, and is implemented with ongoing data collection and oversight. Option D. Recommend a brief period of timeout from reinforcement as a punishment strategy, based on the BCBA's clinical experience with similar cases. Correct answer is A. Implement a positive punishment procedure, such as response blocking, immediately to prevent further harm, while simultaneously collecting data on the frequency and intensity of the self-injurious behavior. Explanation. This scenario presents a professional challenge due to the inherent ethical and legal complexities surrounding the application of punishment strategies, particularly in the context of behavior analysis. The BCBA must navigate the potential for harm, the requirement for least restrictive interventions, and the stringent ethical guidelines that govern the use of such procedures. The need for a clear, data-driven, and ethically sound justification for any intervention, especially one involving punishment, is paramount. The correct approach represents best professional practice because it prioritizes the client's well-being and adheres strictly to the ethical principles and regulatory frameworks governing behavior analysis. Specifically, it emphasizes the requirement for a functional assessment to understand the variables maintaining the behavior, the necessity of exploring less restrictive alternatives before considering punishment, and the critical need for ongoing data collection and evaluation to ensure efficacy and minimize potential harm. This aligns with the principle of beneficence and non-maleficence, as well as the requirement for evidence-based practice. The BAC Ethical Code mandates that behavior analysts only use reinforcement procedures when possible, and that punishment procedures are only used when reinforcement procedures are ineffective, and the behavior poses a significant risk of harm. Furthermore, any use of punishment must be accompanied by a plan to teach alternative, appropriate behaviors. An incorrect approach that involves the immediate implementation of a punishment strategy without a thorough functional assessment or consideration of less restrictive alternatives fails to meet the ethical standard of prioritizing the client's welfare and the principle of using the least restrictive intervention. This could lead to iatrogenic effects, such as the development of new problem behaviors, emotional distress, or a breakdown in the therapeutic relationship. Ethically, this violates the requirement for a comprehensive assessment and the hierarchy of interventions. Another incorrect approach that relies on anecdotal evidence or personal opinion rather than objective data to justify punishment is a direct contravention of the scientific and evidence-based nature of behavior analysis. This demonstrates a lack of professional competence and adherence to the requirement for data-driven decision-making. Ethically, this could be seen as practicing outside the scope of one's expertise and failing to uphold the integrity of the profession. A third incorrect approach that fails to include a plan for teaching replacement behaviors alongside the punishment procedure is also ethically deficient. Punishment alone does not teach the individual what to do instead, which is a critical component of effective behavior change. This violates the principle of promoting functional and adaptive behaviors. The professional decision-making process for similar situations should involve a systematic multi-step approach. First, conduct a thorough functional behavior assessment to understand the antecedents, behavior, and consequences. Second, review the data to identify the function of the behavior. Third, Consider and implement reinforcement-based strategies and other less restrictive interventions. Fourth, if punishment is deemed necessary due to the severity of the risk of harm and the ineffectiveness of other strategies, ensure it is implemented under strict supervision, with a clear rationale, and always in conjunction with a plan to teach and reinforce alternative, appropriate behaviors. Fifth, continuously monitor data to evaluate the effectiveness and side effects of the intervention, and be prepared to fade or modify the intervention as needed. This process ensures that interventions are client-centered, ethically sound, and scientifically grounded. Question 6. Governance review demonstrates that a board-certified behavior analyst doctoral, BCBA supervisor is responsible for overseeing the training of several new behavior analysts. The practice is experiencing high client demand, leading to pressure to maximize billable hours. The supervisor is considering how to structure their supervision to be both efficient and compliant with ethical standards. Which of the following supervision models best aligns with the ethical and regulatory requirements for ensuring supervisory competency and professional development? Option A. A model focused exclusively on task completion and ensuring all data sheets and progress notes are meticulously filled out, with minimal time allocated for discussing the underlying principles or ethical considerations. Option B. A model where supervision primarily consists of reviewing session notes and providing brief, written feedback, with occasional unscheduled check-ins to address immediate client issues. Option C. A model that includes regular, scheduled sessions for direct observation of service delivery, collaborative case conceptualization, structured feedback, and opportunities for the supervisee to present their own analysis and problem-solving strategies. Option D. A model where the supervisor delegates all complex case supervision to more experienced colleagues, with the primary supervisor only signing off on documentation and ensuring compliance with billing procedures. Correct answer is B. A model where supervision primarily consists of reviewing session notes and providing brief, written feedback, with occasional unscheduled check-ins to address immediate client issues. Explanation. Scenario analysis. This scenario presents a common challenge in supervision, where a supervisor must balance the need for efficient service delivery with the ethical and regulatory imperative of ensuring high-quality training and competency development for supervisees. The pressure to increase billable hours and meet client demand can create a conflict with the time and resources required for effective supervision, particularly when dealing with complex cases or supervisees who require more intensive support. The supervisor's responsibility extends beyond simply overseeing tasks. It involves fostering critical thinking, ethical reasoning, and the development of independent professional judgment in their supervisees, all within the established ethical guidelines and regulatory frameworks. Correct approach analysis. The correct approach prioritizes the supervisee's development and the integrity of service delivery by implementing a structured, multifaceted supervision model. This model, which includes direct observation, feedback, case conceptualization discussions, and opportunities for the supervisee to present their own analysis, directly aligns with the BCBA ethical standards for supervision. These standards emphasize ensuring that supervisees acquire the necessary skills and competencies to provide effective and ethical services. By dedicating specific time for these activities, the supervisor demonstrates a commitment to the supervisee's professional growth and adherence to best practices, which ultimately benefits the clients. This approach also ensures that the supervisor is actively monitoring the supervisee's performance and providing timely, constructive feedback, a cornerstone of effective supervision. Incorrect approaches analysis. One incorrect approach involves relying solely on indirect supervision methods, such as brief check-ins or reviewing written reports without direct observation or interactive case discussions. This fails to meet the BCBA requirements for ensuring supervisory competency and can lead to the perpetuation of errors or unethical practices, as the supervisor lacks direct insight into the supervisee's application of principles and their clinical reasoning. This approach also neglects the crucial element of modeling professional behavior and ethical decision-making. Another incorrect approach is to delegate all complex case supervision to more senior staff, without the primary supervisor maintaining direct oversight and involvement in the supervisee's development. While collaboration is valuable, the primary supervisor remains ultimately responsible for the supervisee's training and competency. This abdication of responsibility can lead to inconsistent training, gaps in skill development, and a failure to address the specific learning needs of the supervisee, potentially violating the supervisor's ethical obligations. A third incorrect approach is to focus supervision primarily on task completion and documentation review, neglecting opportunities for the supervisee to develop independent problem-solving skills and ethical reasoning. This transactional approach treats supervision as a compliance exercise rather than a developmental process. It fails to equip the supervisees with the critical thinking abilities necessary to navigate complex ethical dilemmas or adapt interventions to unique client needs, thereby undermining the long-term goal of producing competent and ethical behavior analysts. Professional reasoning. Professionals should approach supervision by first understanding their ethical and regulatory obligations as outlined by the BCBA. This involves recognizing that supervision is a dual responsibility to the supervisee's professional development and to the welfare of the clients they serve. A systematic approach is crucial, involving the development of a supervision contract that clearly outlines expectations, methods, and frequency of supervision. Regular evaluation of the supervisee's progress, coupled with ongoing feedback and opportunities for skill refinement, is paramount. When faced with competing demands, professionals must prioritize the ethical and developmental aspects of supervision, understanding that short-term gains in efficiency should not compromise the long-term competence and ethical practice of their supervisees. This requires proactive planning, clear communication, and a commitment to providing the necessary resources and time for effective supervision. Question 7. Benchmark analysis indicates that a behavior analyst is working with a young child diagnosed with autism spectrum disorder. The child's family recently immigrated from a country with significantly different cultural norms regarding child-rearing practices, communication styles, and family involvement in education compared to the behavior analyst's own cultural background. The family expresses some hesitation about certain proposed intervention strategies, citing concerns that they may conflict with their deeply held cultural values and beliefs about discipline and learning. The behavior analyst has a strong understanding of applied behavior analysis principles, but limited direct experience working with families from this specific cultural background. What is the most ethically and professionally appropriate course of action for the behavior analyst in this situation? Option A. Delegate the primary responsibility for addressing cultural concerns to a less experienced team member or a cultural liaison without direct involvement, focusing solely on the technical aspects of behavior intervention. Option B. Assume that the family's concerns are based on a misunderstanding of behavioral principles and attempt to educate them extensively on the scientific basis of the proposed interventions, overriding their cultural objections if they impede progress. Option C. Proceed with the evidence-based intervention plan as initially designed, explaining the scientific rationale to the family and emphasizing that the effectiveness of the strategies is paramount, regardless of cultural considerations. Option D. Engage in a collaborative dialogue with the family to understand their cultural values, beliefs, and concerns, and adapt the assessment and intervention plan accordingly, seeking consultation if necessary to ensure cultural competence. The correct answer is D. Engage in a collaborative dialogue with the family to understand their cultural values, beliefs, and concerns, and adapt the assessment and intervention plan accordingly, seeking consultation if necessary to ensure cultural competence. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the intersection of behavior analysis practice and the diverse cultural backgrounds of clients. The core difficulty lies in ensuring that assessment and intervention strategies are not only scientifically sound, but also culturally responsive and respectful. Misinterpreting or ignoring cultural nuances can lead to ineffective interventions, client mistrust, and potential harm, violating fundamental ethical principles and regulatory expectations for culturally competent practice. Correct approach analysis. The most effective approach involves actively seeking to understand the client's cultural context and integrating this understanding into the assessment and intervention plan. This aligns with the ethical responsibility of behavior analysts to practice within their areas of competence, which includes cultural competence. Regulatory frameworks, such as those guiding the BCBA, emphasize the importance of respecting client dignity and autonomy, which necessitates culturally sensitive practice. By collaborating with the family to understand their values, beliefs, and communication styles, the behavior analyst can develop interventions that are more likely to be accepted, understood, and implemented effectively within the client's natural environment, thereby maximizing the potential for positive outcomes. This demonstrates a commitment to individualized, client-centered care that respects the client's cultural identity. Incorrect approach is analysis. One incorrect approach involves proceeding with standard assessment and intervention protocols without considering the family's cultural background. This fails to acknowledge the impact of culture on behavior and learning, potentially leading to misinterpretations of the client's behavior and the development of interventions that are incompatible with the family's values or beliefs. This can be seen as a failure to adhere to the principle of providing services that are in the best interest of the client and may violate ethical standards related to cultural competence and respect for client dignity. Another incorrect approach is to make assumptions about the family's cultural practices or beliefs without direct inquiry. This can lead to stereotyping and the imposition of the behavior analyst's own cultural biases onto the client's situation. Such assumptions undermine the collaborative relationship essential for effective intervention and can result in interventions that are not only ineffective but also offensive or alienating to the family. This represents a significant ethical lapse in cultural humility and respect. A third incorrect approach is to dismiss the family's concerns or suggestions regarding cultural appropriateness, viewing them as secondary to the technical application of behavior analysis principles. This demonstrates a lack of understanding of how cultural factors can influence the efficacy and acceptability of interventions. It prioritizes a narrow, technical view of behavior analysis over a holistic, client-centered approach, potentially leading to a breakdown in the therapeutic alliance and a failure to achieve meaningful, sustainable behavior change. This approach neglects the ethical imperative to consider all relevant factors that impact client well-being. Professional reasoning. Professionals should approach culturally diverse clients with humility and a commitment to ongoing learning. The decision-making process should involve 1. Self-reflection on one's own cultural background and potential biases. 2. Active listening and open-ended inquiry to understand the client's cultural context, values, and preferences. 3. Collaboration with the client and their support system to co-create assessment and intervention plans that are culturally congruent. 4. Seeking consultation or supervision when encountering situations that fall outside one's area of cultural competence. 5. Continuous evaluation of the cultural appropriateness and effectiveness of interventions. Question 8. To address the challenge of implementing a token economy for a group of adolescents with autism spectrum disorder to increase social engagement during unstructured break times, what is the most ethically sound and professionally responsible initial step? Option A. Focus solely on defining the target behaviors for social engagement and the initial token reinforcement schedule without considering potential long-term effects or client assent. Option B. Conduct a thorough risk assessment to identify potential negative outcomes, such as token devaluation, dependency, or inequitable access to backup reinforcers, and develop mitigation strategies before introducing the token economy. Option C. Implement the token economy with a simple exchange rate and a limited set of backup reinforcers to avoid overwhelming the adolescents. Option D. Immediately introduce the token economy with a broad range of backup reinforcers to maximize motivation and engagement. The correct answer is B. Conduct a thorough risk assessment to identify potential negative outcomes, such as token devaluation, dependency, or inequitable access to backup reinforcers, and develop mitigation strategies before introducing the token economy. Explanation. This scenario presents a professional challenge due to the inherent risk of unintended consequences when implementing contingency management systems, particularly token economies, with vulnerable populations. The core difficulty lies in balancing the potential benefits of behavior change with the ethical imperative to protect client welfare and ensure the system is applied fairly and effectively. Careful judgment is required to anticipate and mitigate potential harms, such as the devaluation of earned tokens, the creation of dependency, or the exacerbation of existing inequities. The correct approach represents best professional practice because it prioritizes a thorough risk assessment prior to implementation. This aligns with the ethical principles of beneficence and non-maleficence, as outlined in the Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts. Specifically, Code 1.01 Beneficence mandates behavior analysts to always act in the best interests of the client. A proactive risk assessment allows for the identification of potential negative outcomes and the development of mitigation strategies, thereby minimizing harm and maximizing the likelihood of positive outcomes. Furthermore, Code 4.0.1 Assent and 4.0.2 Informed Consent necessitate that clients or their guardians understand the procedures, potential risks, and benefits, which is facilitated by a well-considered and transparent risk assessment. An incorrect approach that fails to conduct a risk assessment before implementing a token economy is professionally unacceptable. This oversight constitutes a violation of Code 1.0.1 Beneficence by not adequately considering the client's best interests and potentially exposing them to harm. Also breaches Code 4.0.1 Assent and 4.0.2 Informed Consent by not fully informing the client or their guardian of potential risks associated with the intervention. Another incorrect approach, such as implementing the token economy without clearly defining the exchange rates and backup reinforcers, violates Code 4.0.7 Minimizing Risks by not ensuring the intervention is designed to minimize risks. The lack of clear definitions can lead to confusion, frustration, and a breakdown of the contingency, potentially resulting in the client not receiving the intended reinforcers, which is a form of harm. A third incorrect approach, focusing solely on the acquisition of target behaviors without considering the potential for token devaluation or the development of a dependency on the token system, fails to adhere to Code 1.0.2 Effects of the Behavior Analyst's Behavior, which requires behavior analysts to be aware of and avoid the negative effects of their professional actions. Professional decision-making in such situations requires a systematic process. First, identify the core ethical principles at play, e.g., beneficence, non-maleficence, autonomy. Second, analyze the specific intervention token economy and its potential benefits and risks for the target population. Third, conduct a comprehensive risk assessment, considering factors such as the client's age, cognitive abilities, history of reinforcement, and the social environment. Fourth, develop a plan to mitigate identified risks and ensure informed consent. Fifth, continuously monitor the intervention's effectiveness and client well-being, making adjustments as needed. This iterative process ensures that interventions are not only effective but also ethically sound and client-centered. Question 9. Cost-benefit analysis shows that obtaining explicit, written consent from a client before sharing their progress reports with their parents, even when parents are the primary funders and decision-makers, is a time-intensive process. However, the potential benefits of maintaining client trust and avoiding ethical violations outweigh the administrative costs. Behavior analyst is working with a minor client and needs to discuss the client's recent behavioral challenges and intervention progress with the parents. The behavior analyst has a general understanding that parents are involved in the client's care. What is the most ethically and legally sound course of action? Option A. Obtain specific, informed, written consent from the client's parents detailing the information to be shared, the purpose of the sharing, and the potential risks and benefits before discussing the progress report. Option B. Share the progress report with the parents without explicit consent, explaining that this is standard practice for minors and that the information is being shared to ensure the client's best interests. Option C. Discuss the progress report with the parents only after the client has explicitly verbally agreed to the disclosure, without seeking parental consent for the disclosure itself. Option D. Proceed with the discussion of the progress report with the parents, assuming their consent due to their role as funders and primary caregivers, and inform them that confidentiality will be maintained to the extent possible. The correct answer is A. Obtain specific, informed, written consent from the client's parents detailing the information to be shared, the purpose of the sharing, and the potential risks and benefits before discussing the progress report. Explanation. This scenario presents a professional challenge because it requires balancing the ethical obligation to protect client confidentiality with the practical need to obtain necessary information for effective service delivery. The core tension lies in respecting the client's autonomy and privacy, while ensuring the behavior analyst has a complete picture to design and implement interventions. The regulatory framework, specifically the BAC Professional and Ethical Compliance Code for Behavior Analysts, mandates that behavior analysts obtain informed consent for all services and maintain confidentiality. This requires careful consideration of who has access to client information and under what circumstances. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the client or their legally authorized representative before disclosing any confidential information. This aligns directly with the ethical principle of respecting client autonomy and the legal requirements surrounding privacy. By clearly explaining the purpose of the disclosure, the specific information to be shared, and the potential risks and benefits, the behavior analyst empowers the client to make an informed decision, thereby upholding the highest ethical standards. This proactive approach minimizes the risk of ethical violations and fosters trust in the therapeutic relationship. An incorrect approach that involves disclosing information without explicit consent, even if the behavior analyst believes it would be beneficial, constitutes a direct violation of confidentiality principles. This breaches the trust established with the client and can have serious legal and ethical repercussions, including disciplinary action from the back. Another incorrect approach, such as assuming consent based on a general understanding or prior interactions, fails to meet the stringent requirements of informed consent, which demands specific and documented agreement for each disclosure. This can lead to misunderstandings and unintended breaches of privacy. Finally, withholding necessary information from a collateral contact without a valid ethical or legal reason, even if attempting to protect confidentiality, could hinder effective treatment and potentially violate the duty to provide competent services. The professional decision-making process for similar situations should involve a systematic evaluation of the ethical and legal obligations. First, identify the relevant ethical codes and legal statutes. Second, assess the specific situation. What information needs to be shared with whom and for what purpose? Third, determine if consent is required and if so, the appropriate method for obtaining it. Fourth, consider potential risks and benefits of disclosure and non-disclosure. Fifth, document all decisions and actions taken. This structured approach ensures that decisions are not only ethically sound, but also legally defensible and in the best interest of the client. Question 10. The audit findings indicate that the current process for conducting functional behavior assessments, FBA, may be overly standardized, potentially compromising the individualized nature of the assessment. Which of the following approaches best addresses this concern while adhering to professional and ethical standards for behavior analysts? Option A. Enhancing training for behavior analysts on the principles of individualized assessment, emphasizing direct observation and the systematic manipulation of environmental variables to identify behavior function, and incorporating case-specific data analysis into the FBA process. Option B. Reducing the frequency of direct observation during FBAs for established clients to expedite the assessment process and allow for more time dedicated to intervention implementation. Option C. Developing and utilizing a universal FBA template that streamlines data collection and analysis across all clients, ensuring consistency and efficiency. Option D. Implementing a mandatory, comprehensive review of all FBA data by a senior behavior analyst before intervention planning, regardless of the complexity of the case. The correct answer is D. Implementing a mandatory, comprehensive review of all FBA data by a senior behavior analyst before intervention planning, regardless of the complexity of the case. Explanation. This scenario presents a professional challenge because it requires the BCBA to balance the need for efficient service delivery with the ethical and regulatory imperative to conduct thorough and individualized functional behavior assessments, FBA. The audit findings suggest a potential systemic issue where the FBA process may be becoming a standardized, less individualized procedure, which can compromise the accuracy and effectiveness of interventions. Careful judgment is required to ensure that the FBA remains a dynamic, client-centered process that accurately identifies the function of behavior, rather than a perfunctory step. The correct approach represents best professional practice because it prioritizes the core principles of behavior analysis and the ethical standards outlined by the BAC. Specifically, it aligns with the requirement for behavior analysts to conduct assessments that are based on direct observation and measurement of behavior and its relation to environmental variables. This approach ensures that the FBA is tailored to the individual client, their specific behaviors, and their unique environmental context. It upholds the ethical obligation to provide competent services and to ensure that interventions are based on scientifically evaluated procedures. This approach is consistent with the ethical code's emphasis on client welfare and the need for data-driven decision-making. An incorrect approach that relies solely on pre-existing FBA templates without sufficient individualized data collection or analysis fails to meet the ethical standard of competence and the requirement for individualized assessment. This approach risks misidentifying the function of behavior, leading to ineffective or even harmful interventions. It also violates the principle of using the least restrictive procedures by potentially implementing interventions that are not precisely targeted to the identified function. Another incorrect approach that involves generalizing FBA findings across clients without reevaluation is a direct violation of the ethical mandate to conduct assessments that are specific to the individual. This can lead to significant errors in understanding behavior function and developing appropriate interventions, potentially causing harm and undermining the integrity of the profession. Furthermore, an approach that prioritizes speed over thoroughness in FBA data collection and analysis, as suggested by the audit's implication of a standardized process, neglects the fundamental requirement for accurate and reliable data, which is the bedrock of effective behavior analytic practice. This can lead to interventions that are not evidence-based for the specific client and behavior, thereby failing to uphold the ethical obligation to provide effective services. Professional decision-making in such situations requires a systematic process of evaluating the current practice against ethical guidelines and regulatory requirements. Professionals should first acknowledge the audit findings and their implications. Then, they should critically examine the FBA process to identify any deviations from best practices and ethical standards. This involves reviewing data collection methods, analysis procedures, and the degree of individualization. When faced with potential process optimization, the professional must ask, does this optimization maintain or enhance the accuracy, reliability, and validity of the FBA in identifying the function of behavior for this specific individual? The decision should always be guided by the principle of client welfare, the ethical code, and the scientific integrity of behavior analysis. Question 11. Assessment of how a BCBAD should strategically select continuing education opportunities to ensure ongoing competence and ethical practice, considering their current client population and professional goals. Option A. Choose professional development activities that are of personal interest but have only a tangential relationship to the BCBAD's primary areas of clinical practice. Option B. Focus on accumulating the highest number of continuing education units, CU, possible, prioritizing activities that offer the most credits even if the content is not directly applicable or of high quality. Option C. Prioritize professional development activities that directly enhance skills and knowledge relevant to current client populations and identified areas for professional growth, ensuring practical applicability and ethical alignment. Option D. Select continuing education based primarily on the lowest cost and maximum convenience, regardless of the specific content or its relevance to current practice. The correct answer is C. Prioritize professional development activities that directly enhance skills and knowledge relevant to current client populations and identified areas for professional growth, ensuring practical applicability and ethical alignment. Explanation. Scenario analysis. This scenario presents a common challenge for BCBADs, balancing the need for ongoing professional development with the practical constraints of time and resources, while ensuring that such development directly benefits client care and aligns with ethical standards. The pressure to maintain credentials and stay current in a rapidly evolving field necessitates strategic choices about how to invest in professional growth. The core challenge lies in discerning which professional development activities offer the most significant return on investment in terms of enhanced clinical skills and ethical practice, rather than simply accumulating credits. Correct approach analysis. The most effective approach involves prioritizing professional development activities that are directly relevant to the BCBAD's current practice, client population, and identified areas for growth. This aligns with the backed emphasis on maintaining competence and providing effective services. Specifically, engaging in continuing education that offers practical skills, evidence-based interventions, or deeper understanding of ethical considerations directly applicable to their work ensures that professional development translates into improved client outcomes. This proactive, needs-based approach is the hallmark of responsible and ethical practice, as it demonstrates a commitment to lifelong learning that serves the ultimate goal of client welfare. It also reflects the spirit of the backed continuing education requirements, which are designed to ensure practitioners remain competent and up-to-date. Incorrect approach is analysis, focusing solely on the lowest cost or most convenient options, without regard for relevance or quality, represents a failure to uphold the ethical obligation to provide competent services. This approach prioritizes expediency over efficacy, potentially leading to the acquisition of superficial knowledge that does not enhance clinical skills or ethical decision-making. Such a choice could violate the ethical principle of providing competent services, as it suggests a lack of genuine commitment to improving one's practice. Choosing activities that are only tangentially related to one's practice, or that are primarily for personal interest rather than professional enhancement, also falls short. While personal interest can be a motivator, the primary purpose of continuing education for a BCBAD is to improve their professional capabilities. This approach risks fulfilling the letter of the continuing education requirement without fulfilling its spirit, potentially leading to a gap between acquired knowledge and practical application, which could indirectly impact client care. Selecting activities based solely on the number of continuing education units, SU, offered, irrespective of content quality or applicability, is another ethically questionable approach. This credit-chasing mentality prioritizes quantity over quality and can lead to a superficial understanding of complex topics. It fails to demonstrate a commitment to deep learning and skill development, which is essential for maintaining competence and providing high-quality services. This approach can be seen as a circumvention of the intent of continuing education requirements. Professional reasoning. Professionals should engage in a systematic process of identifying their current practice needs, client demographics, and areas where their expertise could be deepened or expanded. This self-assessment should then guide the selection of professional development opportunities. A critical evaluation of potential activities should consider the provider's reputation, the evidence base for the content, the opportunity for skill practice or application, and the direct relevance to their work. This thoughtful, needs-driven approach ensures that professional development is a strategic investment in competence and ethical practice, ultimately benefiting the individuals served. Question 12. Comparative studies suggest that research involving individuals with intellectual disabilities can yield valuable insights into effective interventions, but also present significant ethical challenges regarding informed consent and assent. A BCBAD is planning a study to evaluate a novel communication intervention for adults with severe intellectual disabilities who have limited verbal abilities. The proposed intervention involves daily sessions for 12 weeks. The BCBAD has identified potential participants and has developed a consent form for their legal guardians. However, the participants themselves are unable to provide verbal assent due to their cognitive limitations, though some can indicate preferences through nonverbal cues. The BCBAD is eager to begin data collection to address a critical gap in the literature. Which of the following actions best aligns with ethical and regulatory requirements for conducting this research? Option A. Begin data collection immediately after obtaining consent from legal guardians, as the participant's inability to verbally assent makes the process impractical and the potential benefits of the intervention are significant. Option B. Submit the research protocol to an institutional review board (IRB) for review and approval, ensuring that the consent process includes obtaining consent from legal guardians and an attempt to obtain assent from participants using their preferred nonverbal communication methods, with clear procedures for documenting assent. Option C. Obtain consent from legal guardians and proceed with data collection, but forego any attempt to obtain assent from the participants, as their limited communication abilities render such efforts futile and potentially confusing for them. Option D. Proceed with data collection without IRB review, relying on the researcher's professional judgment to ensure participant well-being and the scientific merit of the study, given the urgency of the research question. The correct answer is B. Submit the research protocol to an institutional review board, IRB, for review and approval, ensuring that the consent process includes obtaining consent from legal guardians and an attempt to obtain assent from participants using their preferred nonverbal communication methods, with clear procedures for documenting assent. Explanation. This scenario presents a professional challenge due to the inherent conflict between advancing scientific knowledge through research and ensuring the welfare and autonomy of vulnerable research participants. The ethical imperative to protect individuals, particularly those who may have diminished capacity to consent, is paramount. The BCBAD must navigate the complexities of obtaining informed consent, minimizing risk, and ensuring that the research design itself does not exploit or harm participants. The correct approach represents best professional practice because it prioritizes participant welfare and adheres strictly to the ethical guidelines governing research with human subjects, as outlined by the Behavior Analyst Certification Board, BAC, and relevant federal regulations, e.g., the Common Rule in the U.S. This approach involves a thorough review by an institutional review board (ERB) or equivalent ethics committee, which is a mandatory step for research involving human participants. It ensures that the research protocol is ethically sound, scientifically valid, and that appropriate safeguards are in place to protect participants. The emphasis on assent from individuals who cannot provide full consent, alongside consent from a legally authorized representative, demonstrates a commitment to respecting the autonomy of all individuals involved, even those with limited capacity. Furthermore, the plan to collect data only after IRB approval and to implement a robust data management plan underscores a commitment to ethical conduct and data integrity. An incorrect approach that involves proceeding with data collection without IRB approval is a direct violation of ethical codes and federal regulations. This failure to seek external ethical review bypasses a critical safeguard designed to protect participants and uphold research integrity. It demonstrates a disregard for established ethical governance and can lead to significant harm to participants and damage to the professional reputation. Another incorrect approach, such as collecting data from individuals who cannot provide assent or consent and relying solely on the researcher's judgment of benefit, is ethically indefensible. This approach disregards the principle of autonomy and the requirement for informed consent or its legally permissible substitute. It opens the door to potential exploitation and coercion, as the researcher's personal judgment is not subject to independent ethical scrutiny. A further incorrect approach, which involves obtaining consent from a legally authorized representative, but not seeking assent from the participant even when they can communicate preferences, fails to fully respect the individual's dignity and autonomy. While consent from a representative is necessary, the absence of an attempt to obtain assent, where possible, overlooks the ethical obligation to involve the participant in decisions about their own involvement in research to the greatest extent possible. The professional decision-making process for similar situations should begin with a thorough understanding of the relevant ethical codes, e.g., BAC Ethics Code, and applicable regulations. The BCBA must identify potential ethical issues, such as the vulnerability of the participant population and the nature of the proposed research. Consultation with an IRB or ethics committee is a non-negotiable first step. This consultation process should involve a detailed review of the research protocol, including recruitment procedures, consent and assent processes, data collection methods, risk mitigation strategies, and data security. If the research involves vulnerable populations, specific attention must be paid to ensuring that consent and assent procedures are appropriate and that the potential benefits outweigh the risks. Ongoing ethical reflection and adherence to the principles of beneficence, non-maleficence, justice, and respect for persons are crucial throughout the research process. Question 13. The risk matrix shows that accepting a significant gift from a client, particularly one with whom a long-term therapeutic relationship exists, carries a high probability of impairing professional judgment and creating a dual relationship. A BCBA is offered a substantial monetary gift by a client at the conclusion of a successful long-term intervention. What is the most ethically sound and professionally responsible course of action? Option A. Accept the gift, viewing it as a token of appreciation for successful services rendered, and continue the professional relationship as usual. Option B. Accept the gift but document it extensively and seek immediate supervision to determine how to proceed with the ongoing professional relationship. Option C. Immediately terminate services and sever all professional ties with the client to avoid any appearance of impropriety. Option D. Politely decline the gift, explaining that professional ethics prohibit accepting such items, and offer to assist the client in finding an appropriate way to express their gratitude that aligns with professional boundaries. The correct answer is D. Politely decline the gift, explaining that professional ethics prohibit accepting such items, and offer to assist the client in finding an appropriate way to express their gratitude that aligns with professional boundaries. Explanation. The scenario presents a common ethical challenge in behavior analysis, balancing client welfare with professional boundaries and the potential for conflicts of interest. The risk matrix in this context highlights the potential negative consequences of various actions or inactions. A BCBA must navigate these risks by prioritizing ethical guidelines and regulatory compliance. The correct approach demonstrates best professional practice by prioritizing the client's well-being and adhering to ethical principles that govern the profession. Specifically, it involves a systematic and objective assessment of the situation, seeking consultation, and acting in a manner that avoids harm and maintains professional integrity. This aligns with the ethical obligation to act in the best interest of the client and to maintain professional competence and objectivity. The Behavior Analyst Certification Board, BAC, Ethics Code for Behavior Analysts, or Relevant Governing Bodies Code for the specified jurisdiction, mandates that behavior analysts avoid non-professional relationships that could impair their judgment or exploit the client. Furthermore, it requires them to seek supervision or consultation when their objectivity or competence may be compromised. An incorrect approach that involves accepting the gift without careful consideration or consultation would represent a failure to adequately assess the risk of a dual relationship. This could lead to impaired objectivity, exploitation of the client, and a breach of professional boundaries, violating ethical codes that prohibit such relationships. Another incorrect approach, such as immediately terminating services without a proper transition plan, could be detrimental to the client's progress and well-being, potentially violating the ethical principle of beneficence and non-maleficence. It also fails to uphold the responsibility to ensure continuity of care. A third incorrect approach, such as reporting the gift to a regulatory body, without first attempting to resolve the situation through consultation and ethical decision-making, might be an overreaction and could damage the professional relationship unnecessarily, though reporting is sometimes necessary if ethical breaches are severe and unresolvable. However, the initial step should always involve careful ethical deliberation and consultation. Professionals should employ a structured decision-making process when faced with such ethical dilemmas. This involves identifying the ethical issue, consulting relevant ethical codes and regulations, considering potential risks and benefits of different courses of action, seeking consultation from supervisors or peers, and documenting the decision-making process and the chosen course of action. This systematic approach ensures that decisions are well-reasoned, client-centered, and compliant with professional standards. Question 14. To address the challenge of applying recent research findings on a novel intervention for severe problem behavior to a client with unique co-occurring conditions and limited clinic resources, which approach best reflects professional best practice? Option A. Disregard the research findings because the client's co-occurring conditions and the clinic's resource limitations differ significantly from the study's parameters. Option B. Critically evaluate the methodology, participant characteristics, and reported outcomes of the research. Consider the client's specific needs and the clinic's resource limitations, and adapt the intervention based on established behavioral principles if direct application is not feasible. Option C. Adapt the intervention based on anecdotal reports from colleagues and personal clinical experience, without a thorough review of the original research or a systematic assessment of the client's needs. Option D. Immediately implement the intervention as described in the most recent study, assuming its novelty guarantees effectiveness for all clients with similar target behaviors. The correct answer is B. Critically evaluate the methodology, participant characteristics, and reported outcomes of the research. Consider the client's specific needs and the clinic's resource limitations, and adapt the intervention based on established behavioral principles if direct application is not feasible. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis: the gap between published research findings and the practical realities of service delivery in a specific clinical setting. The professional must balance the imperative to use evidence-based practices with the need to adapt those practices to the unique characteristics of the client, the available resources, and the specific environmental constraints. Over-reliance on a single study without considering its limitations or generalizability can lead to ineffective or even harmful interventions. Conversely, dismissing research outright in favor of anecdotal experience or tradition is a failure to adhere to the scientific principles underpinning the field. The challenge lies in critically evaluating research and making informed, ethical decisions about its application. Correct approach analysis. The correct approach involves a systematic and critical evaluation of the research literature. This includes assessing the methodological rigor of the studies, the characteristics of the participants in the research, e.g., age, diagnosis, severity of behavior, the specific intervention components, and the outcomes reported. It also necessitates considering the client's individual needs, preferences, and the context in which the intervention will be implemented. When research findings are promising but not directly applicable, the professional should consider how to adapt the intervention based on established behavioral principles, potentially conducting a small-scale pilot or functional assessment to inform the adaptation. This aligns with the BCBA ethical code, which mandates that behavior analysts use the best available science-based principles and practices. Specifically, the ethical code emphasizes the importance of basing practice on research and evaluation, and making reasonable efforts to seek out and use the most current, valid, and reliable research applicable to the behavior analytic services being delivered. Incorrect approaches analysis. One incorrect approach involves immediately implementing an intervention described in a single, recent study without critically examining its methodology, participant characteristics, or the fidelity with which it was implemented. This fails to meet the ethical obligation to ensure that interventions are evidence-based and appropriate for the specific client. It bypasses the crucial step of evaluating the generalizability and applicability of the research findings, potentially leading to an ineffective or even detrimental intervention. This approach risks violating the ethical principle of beneficence and non-maleficence by not ensuring the intervention is likely to be effective and safe for the individual. Another incorrect approach is to dismiss the research findings entirely because they do not perfectly match the current client's presentation or the clinic's typical procedures. This demonstrates a lack of commitment to the scientific foundation of behavior analysis and a failure to stay current with advancements in the field. It prioritizes convenience or established routines over the potential benefits of evidence-based practices. This can be seen as a failure to uphold the ethical standard of providing competent services and a disregard for the mandate to use the best available science. A third incorrect approach is to adapt the intervention based solely on anecdotal evidence or the opinions of colleagues without a systematic evaluation of the research or the client's specific needs. While collaboration is valuable, decisions about intervention must be grounded in empirical evidence and ethical principles, not solely on informal discussions or personal experience. This approach risks introducing bias and deviating from scientifically validated methods, potentially compromising client outcomes and violating ethical guidelines related to competence and the use of evidence-based practices. Professional reasoning. Professionals should engage in a continuous process of critical evaluation and informed decision-making. This involves 1. Identifying a clinical need or question. 2. Conducting a thorough literature search for relevant, high-quality research. 3. Critically appraising the research for methodological soundness, generalizability, and relevance to the specific client and setting. 4. Considering the client's individual characteristics, preferences, and the environmental context. 5. Adapting evidence-based interventions as necessary, using sound behavioral principles and potentially conducting preliminary assessments to guide adaptation. 6. Monitoring intervention effectiveness and making data-driven adjustments. This systematic approach ensures that practice is both scientifically informed and ethically sound, prioritizing client well-being and optimal outcomes. Question 15. Strategic planning requires a behavior analyst to interpret a comprehensive assessment of a client's challenging behavior. The assessment includes direct observation data, indirect assessment information, and a review of the client's history. The direct observation data shows variability, with the behavior occurring at different frequencies across different settings and times. The indirect assessment suggests a possible attention-seeking function, but the historical data indicates a history of escape-motivated behavior. Given this complex data set, which approach to developing the treatment plan is most aligned with best professional practice and ethical guidelines? Option A. Synthesize all available data, including the variability in direct observations, the potential attention-seeking function, and the historical escape-motivated function, to form a comprehensive hypothesis about the behavior's function and design an intervention that addresses the most probable function while considering all contributing factors. Option B. Develop a treatment plan that primarily targets the attention-seeking function, as indicated by the indirect assessment, and implement strategies to reinforce alternative communicative behaviors for attention. Option C. Prioritize the development of a treatment plan that addresses the escape-motivated function based on the historical data, and implement strategies to teach coping skills and alternative ways to escape non-preferred tasks. Option D. Implement a treatment plan based on a previously successful intervention for a similar behavior, assuming the underlying function is likely the same, and monitor progress without extensive reanalysis of the current assessment data. The correct answer is B. Develop a treatment plan that primarily targets the attention-seeking function, as indicated by the indirect assessment, and implement strategies to reinforce alternative communicative behaviors for attention. Explanation. This scenario presents a professional challenge because the behavior analyst must interpret complex assessment data to inform treatment decisions for a client with a history of challenging behavior. The difficulty lies in synthesizing multiple data sources, considering the client's unique presentation, and ensuring the chosen intervention is both evidence-based and ethically sound, all while adhering to the BCBA ethical standards and regulatory requirements. The pressure to demonstrate progress and justify continued services adds another layer of complexity. The correct approach represents best professional practice because it prioritizes a thorough, systematic analysis of all available assessment data. This involves not only reviewing the direct observation data, but also considering indirect assessments and the client's history. This comprehensive review allows for the identification of the most probable function of the behavior and the selection of an intervention that directly targets that function. This aligns with the BCBA emphasis on data-driven decision-making and the ethical obligation to provide effective services. Specifically, the BCBA Ethics Code mandates that behavior analysts use the best available science and professional judgment to design and implement interventions. Analyzing multiple data sources ensures a robust understanding of the behavior and its controlling variables, leading to more effective and ethical treatment planning. An incorrect approach that relies solely on the most recent data point fails to account for potential variability in behavior and may lead to an intervention that is not aligned with the underlying function of the behavior. This overlooks the ethical requirement to conduct a comprehensive assessment and can result in ineffective or even harmful interventions. It also violates the principle of using a functional assessment to guide intervention selection. Another incorrect approach that focuses on a previously successful intervention without reevaluating current data risks applying an outdated or inappropriate strategy. Behavior and its function can change over time, and relying on past successes without current data validation is a failure to conduct ongoing assessment and is ethically questionable. The BCBA Ethics Code requires behavior analysts to continuously monitor behavior and adjust interventions as needed based on data. An approach that prioritizes client preference over data-driven functional analysis. While client preference is important, it cannot supersede the ethical and professional obligation to implement interventions based on a functional understanding of the behavior. This could lead to interventions that are not effective in addressing the target behavior, potentially causing harm or delaying progress. The ethical code emphasizes the primacy of client well-being and the use of evidence-based practices. The professional decision-making process for similar situations should involve a systematic review of all assessment data, including direct observations, indirect assessments, and historical information. The behavior analyst must then synthesize this information to form a hypothesis about the function of the behavior. This hypothesis should guide the selection of an intervention that is evidence-based and ethically appropriate. Continuous data collection and analysis are crucial for monitoring progress and making necessary adjustments to the intervention plan. Adherence to the BCBA Ethics Code and relevant regulations is paramount throughout this process. Question 16. Quality control measures reveal that a behavior analyst is providing services to a client who, during a session, expresses significant personal distress and asks the behavior analyst for personal counseling and emotional support, stating they feel the behavior analyst understands them best. The behavior analyst has no prior experience or training in providing personal counseling. Which of the following represents the most ethically sound course of action for the behavior analyst? Option A. Agree to provide personal counseling and emotional support to the client, leveraging the existing rapport to offer a more holistic form of support. Option B. Immediately terminate all behavior analytics services to the client to avoid any potential for a dual relationship. Option C. Acknowledge the client's distress but continue with the planned behavior analytics session without addressing the request for personal counseling, assuming it is outside the professional scope. Option D. Refer the client to a qualified mental health professional for personal counseling and emotional support, while continuing to provide behavior analytics services within the established scope of practice. Correct answer is D. Refer the client to a qualified mental health professional for personal counseling and emotional support, while continuing to provide behavior analytics services within the established scope of practice. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate needs of a client and the ethical obligations to maintain professional boundaries and ensure the integrity of services. The behavior analyst must navigate the potential for dual relationships and the impact on objectivity. Careful judgment is required to uphold ethical standards while addressing the client's expressed desire for support. The correct approach represents best professional practice because it prioritizes the client's long-term well-being and the integrity of the professional relationship by adhering to ethical guidelines that prevent dual relationships. Specifically, the Behavior Analyst Certification Board, BCBA Ethics Code for Behavior Analysts, effective 2022, emphasizes the importance of avoiding relationships that could impair professional judgment or exploit the client. By referring the client to a different professional for personal support, the behavior analyst upholds the principle of beneficence and non-maleficence, ensuring that the client receives appropriate, unbiased support without compromising the therapeutic relationship or the behavior analyst's objectivity. This aligns with the ethical mandate to maintain professional boundaries and avoid conflicts of interest. An incorrect approach that involves providing personal counseling to the client would represent a significant ethical failure. This would constitute a dual relationship, violating the BCBA Ethics Code's prohibition against exploiting professional relationships for personal gain or engaging in relationships that could impair professional judgment. Such a breach could lead to compromised objectivity, undue influence, and potential harm to the client, as the behavior analyst's primary focus on behavior analysis services would be diluted. Another incorrect approach, such as ignoring the client's request and continuing with the behavior analytics services without addressing the boundary issue, would also be professionally unacceptable. This failure to acknowledge and address the client's expressed need for support, even if outside the scope of behavior analysis, demonstrates a lack of empathy and could damage the therapeutic alliance. It also fails to proactively manage the ethical dilemma, potentially leading to further complications. A third incorrect approach, such as terminating services abruptly without a proper referral, would also be ethically problematic. While it avoids the dual relationship, it fails to ensure continuity of care and support for the client, potentially leaving them in a vulnerable position. Ethical practice requires a thoughtful and planned termination process that includes appropriate referrals when necessary. The professional decision-making process for similar situations should involve a systematic ethical analysis. This includes identifying the ethical principles at play, e.g., beneficence, non-maleficence, integrity, professional boundaries, consulting the relevant ethical code, BCBA Ethics Code, considering the potential risks and benefits of each course of action for all stakeholders, and seeking supervision or consultation when faced with complex ethical dilemmas. The goal is to make a decision that upholds ethical standards, protects the client, and maintains the integrity of the profession. Question 17. Compliance review shows that a BCBA is developing an intervention plan for a client exhibiting frequent, disruptive vocalizations in a classroom setting. The BCBA has observed the client for several sessions and has noted the general context, but has not systematically recorded specific antecedent events or immediate consequences. The BCBA is considering several methods for future data collection to better understand the function of these vocalizations. Which of the following approaches would best align with the ethical and professional standards for conducting a functional assessment in this context? Option A. Prioritize collecting data on the client's social interactions with peers, assuming the vocalizations are primarily attention-seeking. Option B. Begin recording detailed narratives of everything that happens in the classroom during the observation periods, hoping to capture relevant information incidentally. Option C. Focus solely on tallying the number of vocalizations per class period to quantify the behavior's frequency. Option D. Implement a structured ABC antecedent behavior consequence, data collection system to systematically record the events immediately preceding and following each vocalization, along with a precise description of the vocalization itself. Correct answer is D. Implement a structured ABC antecedent behavior consequence, data collection system to systematically record the events immediately preceding and following each vocalization, along with a precise description of the vocalization itself. Explanation. This scenario presents a professional challenge because it requires the BCBA to balance the immediate need for data collection with the ethical imperative to ensure the data is accurate, reliable, and collected in a manner that respects the client's dignity and privacy. The core of the challenge lies in selecting the most appropriate direct observation method for a complex behavior in a naturalistic setting, where environmental variables can be numerous and difficult to isolate. The BCBA must consider the behavior's topography, the setting's constraints, and the feasibility of different data collection methods to ensure the data collected will be meaningful for intervention planning. The correct approach represents best professional practice because it prioritizes the systematic and objective collection of data that directly relates to the target behavior and its controlling variables. This aligns with the ethical standards of the Behavior Analyst Certification Board (BAC), which mandate that behavior analysts use the least restrictive and most effective assessment and intervention methods. Specifically, ABC data collection, when implemented correctly, provides a functional understanding of the behavior by identifying antecedents and consequences, which is crucial for developing evidence-based interventions. The BAC Professional and Ethical Compliance Code for Behavior Analysts (PEC) emphasizes the importance of data-based decision-making and the need for accurate and reliable data. An incorrect approach that relies solely on anecdotal descriptions fails to meet the PEC requirements for objective measurement. Anecdotal records are subjective and lack the systematic structure needed to identify functional relationships, potentially leading to misinterpretations of the behavior's function and the development of ineffective interventions. This violates the principle of using empirically supported practices. Another incorrect approach that focuses only on the frequency of the behavior without considering antecedents and consequences overlooks the critical functional aspect of behavior analysis. While frequency is a valid measurement, it does not provide the necessary information to understand why the behavior is occurring, thus hindering the development of a targeted and effective intervention plan. This also falls short of the PEC mandate to conduct thorough functional assessments when appropriate. A third incorrect approach that attempts to collect data on every conceivable environmental variable is impractical and likely to result in incomplete or inaccurate data. The PEC guides behavior analysts to use efficient and effective methods. Overwhelming the data collection process with too many variables can lead to observer bias, fatigue, and a loss of focus on the most relevant antecedents and consequences, ultimately compromising the integrity of the assessment. The professional decision-making process for similar situations should involve a systematic evaluation of the target behavior, the assessment environment, and the available resources. The BCBA should first define the target behavior with precision. Then, they should consider the most appropriate data collection method that will yield functional information. This involves weighing the benefits of detailed antecedent consequence recording against the practicalities of the setting and the observer's capacity. The PEC emphasis on client welfare and data-based decision-making should guide the selection, ensuring that the chosen method will lead to effective and ethical interventions. Question 18. Consider a scenario where a board-certified behavior analyst Doctoral, BCBA, is developing a novel intervention to address severe self-injurious behavior in a group of adolescents with intellectual disabilities. The BCBA wants to rigorously evaluate the intervention's effectiveness before widespread adoption. Which experimental design approach would best balance the need for scientific evidence with the ethical imperative to provide immediate and effective treatment to all participants? Option A. A single-subject withdrawal design where the intervention is implemented, then withdrawn, then re-implemented for each adolescent, without considering the potential risks of withdrawal for severe self-injurious behavior. Option B. A concurrent treatment design where all adolescents receive the novel intervention simultaneously without a baseline phase. Option C. A randomized controlled trial comparing the novel intervention to a placebo intervention, but delaying the introduction of the novel intervention to the control group until the study concludes. Option D. A multiple baseline design across participants, introducing the intervention sequentially to each adolescent after a stable baseline is established for each. The correct answer is D. A multiple baseline design across participants, introducing the intervention sequentially to each adolescent after a stable baseline is established for each. Explanation: this scenario presents a common challenge in applied behavior analysis, balancing the need for rigorous experimental control with the ethical imperative to provide effective and timely interventions. The professional challenge lies in selecting an experimental design that can demonstrate the efficacy of a novel intervention while minimizing potential harm or delay in treatment for individuals with significant behavioral needs. Careful judgment is required to weigh the scientific validity of different designs against their practical and ethical implications. The correct approach represents best professional practice because it prioritizes the individual's right to effective treatment while still striving for a degree of experimental rigor. A multiple baseline design across participants, when implemented appropriately, allows for the introduction of the intervention to each individual sequentially. This design inherently controls for extraneous variables by demonstrating that the behavior change occurs only after the intervention is introduced for each specific participant, thus establishing experimental control. This aligns with ethical standards that mandate the use of the least restrictive and most effective interventions, and regulatory frameworks that emphasize evidence-based practices. An incorrect approach that involves a single subject design without adequate baseline data or a clear withdrawal/reversal phase would fail to establish a clear functional relationship between the intervention and the behavior. This could lead to the implementation of an ineffective treatment, violating the ethical obligation to provide competent services and potentially delaying access to effective interventions. Regulatory bodies often require evidence of treatment efficacy, which such a design might not adequately provide. Another incorrect approach that utilizes a group design without a control group or randomization would lack the necessary comparison to attribute changes solely to the intervention. This would compromise the internal validity of the study, making it difficult to conclude that the intervention was responsible for any observed improvements. Ethically, this could lead to the widespread adoption of an unproven intervention, potentially harming a larger population. From a regulatory standpoint, this could be seen as a failure to adhere to standards of scientific rigor required for evidence-based practice. A further incorrect approach that involves implementing the intervention to all participants simultaneously without any baseline or comparison condition would completely preclude the establishment of experimental control. This would be a significant ethical failure, as it would be impossible to determine if the intervention was effective or if observed changes were due to other factors. This approach would not meet the standards for evidence-based practice and could lead to the continuation of ineffective treatments, violating professional and regulatory expectations. The professional decision-making process for similar situations should involve a thorough assessment of the individual's needs, the severity and nature of the target behavior, and the available resources. A review of the existing literature should inform the choice of intervention and design. Ethical considerations, including the potential risks and benefits of each design, must be paramount. Consultation with supervisors, colleagues, and potentially an ethics committee can provide valuable guidance. The chosen design should aim to maximize internal validity while minimizing disruption to the ongoing provision of effective services, always prioritizing the well-being and progress of the individual served. Question 19. The investigation demonstrates that a behavior analyst is considering how to best understand the function of a client's challenging behavior to inform intervention, while also acknowledging the client's immediate need for support. The analyst is weighing the merits of different approaches to gathering this critical information. Option A. Rely solely on informal observations and clinical judgment to infer the function of the behavior and select an intervention. Option B. Postpone all intervention until a fully controlled, single-subject experimental design can be implemented in a dedicated research setting. Option C. Conduct a series of systematic, controlled manipulations of antecedent and consequence conditions within the context of ongoing service delivery to identify functional relationships. Option D. Immediately implement a widely recognized, evidence-based intervention for the target behavior without further assessment of its specific function for this client. The correct answer is C. Conduct a series of systematic, controlled manipulations of antecedent and consequence conditions within the context of ongoing service delivery to identify functional relationships. Explanation. This scenario presents a professional challenge because it requires the behavior analyst to balance the need for rigorous experimental control with the ethical imperative to provide effective and timely services to a client. The client's progress is a primary concern, and delaying potentially beneficial interventions for the sake of a perfectly controlled experiment, especially when the client's needs are pressing, raises ethical questions about beneficence and non-maleficence. Careful judgment is required to determine if the proposed experimental manipulation is ethically justifiable and scientifically sound given the client's circumstances. The correct approach represents best professional practice because it prioritizes the client's well-being while still adhering to scientific principles. By conducting a functional analysis within a service delivery context, the behavior analyst is attempting to gather essential information to inform treatment decisions without unduly delaying necessary interventions. This aligns with the ethical guidelines that emphasize providing services that are scientifically sound and effective, and that are delivered in a way that minimizes harm and maximizes benefit. The systematic manipulation of antecedent and consequence conditions, even within a service context, allows for the identification of functional relationships, which is a cornerstone of experimental analysis. This approach demonstrates a commitment to evidence-based practice and client-centered care. An incorrect approach that involves immediately implementing a standard, predetermined intervention without first conducting an experimental analysis to understand the function of the behavior would be professionally unacceptable. This fails to adhere to the principle of providing services that are scientifically sound and effective, as it bypasses the crucial step of functional assessment. It could lead to the implementation of an ineffective or even detrimental intervention, violating the ethical principle of non-maleficence. Furthermore, it neglects the opportunity to gather data that could lead to a more efficient and targeted intervention, potentially delaying client progress. Another incorrect approach would be to postpone all service delivery until a fully controlled, single-subject experimental design can be implemented in a research setting. This would be ethically problematic due to the potential for significant harm to the client through prolonged lack of effective intervention. It also fails to acknowledge that experimental analysis can and should be integrated into clinical practice to inform treatment, rather than being solely confined to research laboratories. This approach prioritizes experimental purity over client needs and beneficence. A third incorrect approach would be to rely solely on anecdotal observations and clinical intuition to guide intervention, without any systematic manipulation or data collection. This lacks scientific rigor and is not aligned with the principles of experimental analysis of behavior. It increases the risk of implementing ineffective interventions and failing to identify the true function of the behavior, thereby not serving the client's best interests and potentially violating ethical standards related to competence and the use of evidence-based practices. The professional decision-making process for similar situations should involve a thorough functional assessment, considering the client's immediate needs and the ethical implications of different experimental approaches. The behavior analyst must weigh the potential benefits of experimental control against the potential risks of delaying intervention. Collaboration with the client and other stakeholders is crucial. The goal is to design and implement interventions that are both scientifically sound and ethically responsible, ensuring that the pursuit of knowledge does not compromise the well-being of the individual receiving services. Question 20. Upon reviewing the existing literature on a novel intervention for severe problem behavior in adolescents, a BCBAD is tasked with synthesizing the findings to inform clinical recommendations. Which approach best reflects the ethical and professional obligations of a board-certified behavior analyst doctoral? Option A. Prioritize synthesizing studies that demonstrate statistically significant positive outcomes, regardless of the methodological limitations or the specific population studied, to provide the most optimistic outlook for intervention efficacy. Option B. Focus on synthesizing anecdotal reports and case studies from experienced practitioners, as these often provide practical insights that may not be captured in controlled research. Option C. Conduct a comprehensive search for all available literature, critically appraising the methodological rigor, internal validity, and external generalizability of each study, and synthesize findings, acknowledging both supporting and contradictory evidence, to inform evidence-based recommendations. Option D. Selectively review studies that align with a preferred theoretical orientation or intervention strategy, and emphasize those findings while downplaying or omitting contradictory research to support a predetermined conclusion. Correct answer is A. Prioritize synthesizing studies that demonstrate statistically significant positive outcomes, regardless of the methodological limitations or the specific population studied, to provide the most optimistic outlook for intervention efficacy. Explanation: the scenario presents a professional challenge because a BCBAD is tasked with synthesizing a broad and potentially conflicting body of literature to inform clinical practice. This requires not only understanding the research, but also critically evaluating its quality, relevance, and applicability to specific client populations and contexts, all while adhering to ethical standards and regulatory requirements. The challenge lies in moving beyond a simple summary to a nuanced synthesis that guides effective and ethical service delivery. The correct approach represents best professional practice because it involves a systematic and critical evaluation of the literature, prioritizing empirical evidence and considering the methodological rigor of the studies. This aligns with the BACP emphasis on evidence-based practice and the ethical obligation to provide services supported by scientific literature. Specifically, the BACP Ethical Code, e.g., Section 1.0, Reliance on Scientific Knowledge, mandates that behavior analysts base their professional decisions on scientific and professional knowledge, and that they recommend and use only those interventions that are supported by research. A thorough literature review that critically assesses the quality and applicability of findings ensures that recommendations are not only evidence-based, but also ethically sound and client-centered. An incorrect approach that focuses solely on the quantity of studies, regardless of their quality or relevance, fails to meet the ethical obligation to provide effective services. This could lead to the adoption of interventions that are not well supported, potentially ineffective, or even harmful. Such an approach violates the principle of providing services based on scientific knowledge and could be seen as a failure to exercise due diligence in selecting interventions. Another incorrect approach that prioritizes anecdotal evidence or personal experience over peer-reviewed research directly contravenes the BACP Ethical Code, which emphasizes reliance on scientific knowledge. Anecdotal evidence lacks the rigor and generalizability required for evidence-based practice and can lead to biased decision-making. This approach risks misrepresenting the state of the science and could result in the implementation of unvalidated practices. A further incorrect approach that selectively highlights findings that support a pre-existing bias or preferred intervention, while ignoring contradictory evidence, represents a significant ethical failure. This practice is a form of confirmation bias and undermines the objectivity required for scientific practice. It violates the ethical principle of providing objective and unbiased professional services and can lead to suboptimal or harmful outcomes for clients. The professional decision-making process for similar situations should involve a systematic and critical approach to literature review. This includes defining clear research questions, employing comprehensive search strategies, critically appraising the quality of identified studies, e.g., considering study design, sample size, internal validity, synthesizing findings across studies, identifying gaps in the literature, and considering the applicability of findings to the specific client and context. Professionals should always prioritize empirical, peer-reviewed research and be transparent about the limitations of the available evidence.